This very pleasant woman has some fullness to her eyelids that bothers her. We're going to do an upper blepharoplasty, support her brow fat pad. And then she has some puffiness to the lower lids. We'll do a transconjunctival blepharoplasty, tightening of the lid and taking a little skin out. So you can see she wants some of the fullness reduced. She has this herniated fat pad. There's a little extra skin on exam, so we'll tighten the lid and take that out, and she'll do fantastic. Okay, so we're going to begin marking for the upper blepharoplasty. This woman's of Asian descent. I'm going to use her existing crease. She's got a big epicanthal fold here. She didn't need too much skin taken off medially, mostly laterally. I may lower her laterally. Let's see. Because we have her at maybe 6 millimeters then. I think I'm going to lower her here to about that level. So just marking on this side too. I'm mostly a fat preservation blepharoplasty surgeon, but in her case, she may benefit from some fat reduction to the brow fat pads and to the eyelids too. She did not need a lot removed, and we don't want to overtake it. She just really wanted some suspension sutures. I think if we overdo it on her, she'll feel it was too much. And probably on her, we can continue this just to this point here. She really didn't want to be overdone at all. Most of the time when I do upper blepharoplasties, I, in the center part, will angle up. In this particular case, I'm not going to. I'm just going to come to the point. All right, let's go ahead and inject. Bevel up. We're going to remove some of her brow fat pad. Again, I didn't want to make a drastic difference in her because it could change some of her characteristics on patients that have Asian descent. I think overexcising fat is a mistake, overexcising muscle or any of those things. Hydrodissecting, skin from muscle. And now we'll inject her lower lids. We're going to make a decision on repositioning in her when we're there, so I'll just loosely inject here. She also has a little lesion that she may want removed. So the majority of patients that I do blepharoplasty on are fat preservation procedures, preserving eyelid fat, preserving brow fat pad, relocating it. There are people whose eyelids tend to be puffier, like this woman, where we do some fat reduction. That's what we'll do on her. So we're just going to make an incision through the skin. Little thicker brow skin there. Again, I'm being conservative in what I take out on her. Okay, we'll take some skin off of here, preserve muscle. Again, I'm putting it on stretch, using my pinkies to stretch, so everything's on stretch, and every stroke is from one end through to the other. The reason is you don't want to get to the point where you're way ahead on one side than the other. It's harder to stay in that same plane, I believe. So just stroke all the way across. If you look here, you can see my instrument. So you know that you just have skin there, and you can see we've preserved the muscle here. Muscle is important to preserve, I believe, long term. There's no studies that have shown superiority of preserving or excising muscle, but we do lose muscle function as we get older. We know that for a fact, so why take it out? Asian eyelids are very different than Caucasians. We're not going to form her a formal crease. She already has one. I used it. It creates much more pretarsal swelling. But we are going to, on her, reduce her brow fat pad. So we're lifting here. You can see the tarsus flipping on itself out here, actually. So I'm going to stay up high. And the assistant pulls. There's the fat pad. We don't want to over-reduce most people, but in this particular case, I believe that this tends to be a puffier, heavier lid. So there'll be some reduction. Now, to get to the nasal fat pad, it's here. We may have not extended the incision enough, so I may have to just extend it to find that. We'll see. So this right here is her nasal fat pad. You can see it. That's nasal fat. This yellower fat is not nasal. Let me separate the attachments of the septum to the aponeurosis still, so that this fat is more visualized to you. Her nasal fat is here. I'm going to get one blood vessel she has there. And if I blot, you'll see it come forward. Let's see if we could. And on Asians, this is fibrous. On Caucasians, it tends not to be fibrous. Very fibrous fat here. But not a lot, so we can just do that. And we have the nasal fat. This is the other fat. And let me go ahead and separate it from lateral tissue. And that's a bit of her lacrimal gland that she does tend to have heavy. I'm going to reduce that a bit too because her eyelids tend to be a bit heavy. Let's see the anatomy here. I'm going to open up more attachments of the septum to the end. This is the lacrimal gland. It was a little prominent on her. So this is her orbicularis muscle. Undersurface of it. This is the levator, aponeurosis. We don't really see what else ligament. Well, there may be hints of it there. This is the brow fat pad. We're going to resuspend that, and I'm going to actually reduce it for her a little bit. That's one of her false eyelashes, which we'll get out of the wound. Come on out for a second. Let's see if we can do something with this brow fat pad. Now I'm going to inject it. She tends to have puffy eyelids. There are ways to reduce this. I'm usually a fat preserver, but in her case, we're going to take a little of it out because I think it's a bit bulky, and it was a concern of hers. So what we do is we take two 4-prong rakes again, and I'll call this brow fat pad reduction. We put one here, put one here with two hands. And what you can do is, there's a little capsule on top of this. You can open it and just cut this down, the extent of which is up to you. That's brow fat, not eyelid fat. Stay away from too medial because of the supraorbital nerve, but we're at a distance from that. And you could liposculpt this down, reduce it more in other ways. Very common in thyroid patients. You can see there's still a lot of it there. I don't want to overdo her, but I just wanted to kind of sculpt it down for her. And then transition nicely there. Come on out. Now we injected her so it's still thick, but we just reduced it. So we took some of this bulk off, and I don't want to remove all of it. So at this point, let's go ahead and put that brow fat suspension suture in. We're still going to do a closed canthal suspension on her. And I think we're going to reduce this fat pad too. Let me take a scissors. I think she doesn't need all this bulk, and again, I rarely do this. We're going to take some of that out. Could you save that fat for me? Put it in something wet. So here's a bite from inferior wound edge orbicularis. Use the needle for traction above. This is her arcus marginalis periosteum. You can see it here. Suture going through it. We'll secure it. This will elevate her brow fat pad. I reduced it, so we reduced some of the volume, but this will still elevate it and bunch it on itself. So it gives you some volume, which is fine, but she'll be thinned out. And some of her volume to her brow now is just from the injection of anesthetic that I gave her. We'll put another one of these in at the end. I just want to leave room for that suspension suture. She wanted subtle changes on her, so we're not going to overdo it. This suture will be used to expose this, the arcus marginalis periosteum. And the reason we can use that, we can put 4-prong rakes and such in here, but you don't need to. You can just use this to expose what you need to. and then put a suture through it. Sutures through it. Lift it. You want to make sure it doesn't engage the levator aponeurosis as not to cause a motility deficit. The paper we published on this was 240 patients. A few patients had mild issues with closure of the eye afterwards. You are cutting the orbicularis. And there are a few that had ptosis. The ptosis went away very quickly. The orbicularis deficit patients were all redos. It all went away, and within a month their function came back to normal. Now, this fat over here, we do want to preserve some of our fat so we can put that back in the orbit. And that this area of hollowing creates an A-frame. We don't want that. Now, the question is, when I did this, I think you can see when she opens her eye that in the middle, her fold will stay the same, and here her pretarsal show should be the same on both ends too. All right, so we'll do the same thing on this side. Raise a skin flap again. It's one stroke all the way across. I'm going to start on one side, I go on the other. You can see that this can occur. It's not about being fast, it's about being fluid, but you can see how fluid this really is. When you take time doing this, sometimes what happens is we're burning skin. That little fake crease you could form here, she has one already, we don't have to. Okay, now we'll put the 4-prong rakes in. Lift. And I use my pinky, 2/3, 1/3. You see the fat. I'm under, this is the orbicularis tent. And then I'm going to dissect. This is the central fat pad that on her migrated laterally. It's a very common thing that happens. Really voluminous fat, don't you think? This is why I think she doesn't need more volume. It's one of those rare patients where volume reduction, blepharoplasty, makes a difference. You can see here her lacrimal gland, the orbital lobe of it. This is the central fat pad, orbicularis, undersurface orbicularis. The levator aponeurosis, the central fat pad. Lacrimal gland, this is the arcus marginalis periosteum. The brow fat is invested with fascial layers that come from the deep layer of the galea. In other words, that layer that's under the frontalis muscle. And it splits into 2 layers and engulfs the brow fat pad that way. In Asians, the brow fat pad, or the roof, continues into the eyelid is the retroorbicularis fat. And in Caucasians, it's the posterbicular fascial plane, not a fat pad per se. We're going to have her lift this and this. We're going to reduce this fat pad too, like we did on the other side. If it bleeds, I'll just cauterize. Sometimes you see twitching of the nerve out here. It doesn't cause a... Come on out. I want to make sure that there's no step off, so I feel with my fingers to make sure that we were smooth, and the way we did that, we didn't create any kind of step off here. Feels pretty smooth to me. Again, there's a lot of fat here. I think that we could remove some of this. One of the rare cases where I'm removing fat from an eyelid. Do you have the chromic suture? We'll do the brow fat suspension sutures here. I'm pulling from below. This is the orbicularis muscle. Pretty routine. I injected the brow fat pad here for hemostasis, so it's a little more voluminous. That'll go down in a few minutes. Pull, grasp, suture. PGS. Pull,